Dr. Zaibak, I want to ask you a question about gum disease, periodontal disease, and here's what I find dentists usually saying to patients who start having periodontal disease. They say, if you don't fix it another year, 2, 3, whatever, a few years down the road, you will lose all of your teeth. Now, while that is a bad saying, and you have explained in other videos on how missing teeth, can ruin your bite, make your teeth crunching, make you headaches, and really, get the lifestyle very much down. So it's definitely not a good thing. However, at the very least, you dentists have become very, very good in replacing teeth, whether that is with a denture which is implant supported and really not all that expensive, whether it's with all kinds of implants, or so anyway, we're not anymore living in the time where George Washington apparently was wearing a wooden tooth. So you do a good job there. It looks to me that the main problem of gum disease is, here's what I have heard is going on. You have a disease in your mouth. It is poisoning your body minute by minute. Apparently there are stories out there where women have premature births, their baby are underweight. In California there was even one baby who got stillborn because of they found gum disease stuff in the placenta. People's immune system goes down, kidneys get destroyed, livers get destroyed, people become weak, all kinds of things are happening. It looks to me that repairing that damage, which goes on for a bunch of years, is a lot worse than losing the teeth, which in itself isn't exactly nothing either, and for sure it will cost a bunch of money. Tell me, how far off am I with this assumption?
As surprising and as scary as it sounds, from what you're saying, it's all 100% accurate. Periodontal disease is linked to low birth weight children. It is linked to heart disease. It is linked to strokes. It can be very life-threatening. So, we always advise patients when we see periodontal disease, because now there is a link with heart disease, specifically strokes, diabetes, and so on, that is the most important thing they need to take care of to get a handle, not just in their mouth, but our overall health, because it can be very dangerous. The plaque on the teeth, which is calculus, can travel through the bloodstream, and then eventually cause clots, and so forth. So it is very crucial that when a person has periodontal disease to treat it, whether it be being with a deep cleaning or scaling, root cleaning, and so on, and periodontal surgery, and is very important. It should not be taken lightly.
Well, is it true that a person who has a pretty, let's say, relatively full-blown periodontal disease, or shortly before, that the area of infection, which a periodontal disease is, it's an infection, is literally as large as the hand, and a normal person, when he gets like a time of an infection on the hand, which is as big as a nickel or something, and it doesn't go away for a day, 2, 3, or whatever, he usually runs to a doctor, as he should. If he gets an ingrown toenail, he runs to a doctor, as he should, to get it fixed. And when he has a much larger infection in the mouth, which happens to be the gateway for all the blood vessels, meaning any infection there can drip into the blood vessel faster than anywhere else. As we know, if a person is half unconscious or whatever, you put whatever stuff under the tongue and he goes, ooh. Why? Because the stuff goes right into the blood. So is it true that this infection in the mouth is actually about as large as the hand if it's relatively advanced?
Well, the mouth obviously has the most blood vessels in it, so a lot of bacteria can travel from the mouth to the bloodstream. So yes, it can definitely cause a big infection.
Well, lately in the last whatever, few years, couple, 2, 3, maybe more years, and probably always to a degree, but more and more and more surgeons, whether it's a guy who does take out appendix or does the tonsils or replaces a hip, they seem to be more and more demanding that the patient is getting a clean bill of oral health from a dentist before they do surgery, because they have noticed that if the body is predisposed to this gum disease, the body is weakened. And now cutting in somewhere else might complicate that surgery. And if that's true, wouldn't that show us that, if we get a flu season, whether it's a swine flu or bird flu or just the next normal flu season, which surely will come, that the body's immune system is weak, and maybe that we even become tired and exhausted throughout the day. If surgeons come around and say, first fix your gum disease, otherwise it's dangerous to operate on you.
Absolutely. Every day, just today basically, we see patients that are referred to us from hospitals, big name hospitals locally in the area, and they need something called a dental clearance. Well, a dental clearance is basically that they need to do a transplant or a surgery, a major surgery in the hospital, and they cannot take the risk of a possible mouth infection because it can compromise the surgery, whether it be the kidney transplant or heart transplant and so on. So we do dental clearance. Due to my training, I've had training at Loyola Hospital called Advanced General Practice Residency, and in that training it was specifically geared towards basically dental clearance to hospitals. It can compromise significantly, and from the research and the data that it shows, as they should be getting a dental clearance prior to that. Once the dental clearance is done and the disease is controlled, then the patient is free to have the surgery.
Because he's in better shape, because he's now stronger, right?
Yes, absolutely.
Yeah, and what really I kind of like, if this is the case, which it apparently is, what I think is the point here to get across to the patient is, if you are weakened because your immune system, your defense system needs to go to one area of the body with full force, like soldiers have to go to one war in full force, and then if a second one comes in or a third one, that couldn't possibly be good, and that second war or third war, in our case, could be a cold, could be any type of virus going around in the city or in the family, or just makes a person tired and exhausted. People don't think so well. They're not so happy. They even sometimes, because of it, might get on depressed drugs. Maybe I'm stretching the whole thing, but the point is the body is weakened. Again, thank you very much, even though, yes, this is scary, but I guess that's why people do need to know about it, because it looks to me like this is a very heavy, silent, death. It's kind of, you're chipping away at your health like crazy. By the way, is it true that people who have all their teeth, because people who have a gum disease will lose their teeth, but people who have all their teeth and basically have kept a good oral health their whole life, that on an average you can really demonstrate that they live longer? Is that true?
Yeah, there's research that shows that 100%. Periodontal disease is a foundation of the oral cavity. You need to make sure you have no periodontal disease before you can, if you have periodontal disease, most likely you are not living healthy.
Thank you very much, Dr. Zaibak. Thank you very much for your candidness. Bye-bye.